Welcome to today's program, and thank you for joining us. I'm C. Virginia Fields, former Manhattan Borough President and currently the President and CEO of the National Black Leadership Commission on AIDS, Inc. The mission of the National Black Leadership Commission on AIDS, also known as NBLCA, is to educate, mobilize, and empower black leaders to meet the challenge of fighting HIV/AIDS and other health disparities in their local communities. And today, we will discuss efforts to address the epidemic of HIV/AIDS in communities of color on Long Island, Nassau, and Suffolk counties. Often when we talk about HIV/AIDS in New York State, the conversation tends to focus on New York City, which clearly bears the heaviest burden. However, Nassau and Suffolk counties combined had over 6,200 people living with HIV/AIDS as of at the end, I should say, of 2013. People of color are disproportionately hit. And even though these two counties are majority white, 28% of people with HIV and or AIDS diagnosis are African American, and 33% are Hispanic. So the need is great, and today we'll speak with two people who are doing tremendous work about what we want to look at with respect to HIV and AIDS. And both of them work for NBLCA. My guests today include Johnny Mora, NBLCA's program coordinator for Suffolk County, and Barbara Laing, program coordinator for the Nassau region. Welcome to both of you, Johnny and Barbara, and I thank you so much for coming today. You know, this is kind of different for us because we do this show monthly, but actually we tend to focus on the work that other groups are doing. So I think this is probably the first time that we will really be focusing on the work of NBLCA specifically. We often talk with people and how we partner with them to do various things, but this is really the first time we got a chance to showcase our programs, and let me thank both of you for all that you do out in Nassau and Suffolk County. And now we've been able, as a result of some additional funding from the AIDS Institute, able to expand our work into Suffolk, and I'm very, very delighted about that, especially when we look at the number, 6,200 people, and for the county to be as small, both combined, as they are, those numbers are quite high. So first, why don't you tell us what are some of the biggest challenges that you are facing? Let's begin with you, Barbara, since you've been working in Nassau and spreading out in Suffolk, and then Johnny. But what are some of the biggest challenges you're facing out in that area?
Okay. In Nassau County, what I'm finding is that there is a lack of education, knowledge about HIV, hepatitis, and health disparities just in general. We were able to do a small survey, and what we found out is within the Freeport, Hempstead, Uniondale, Rockville Center communities, a lot of people are not knowledgeable on even how the HIV virus is spread. When they were asked what were how they identified sexually, what their sexual identity was, a few of them were not even able to identify the word heterosexual, what it meant. A lot of them were not able to tell me whether the fluids that are transmitted to have what fluids are the HIV virus lives in. So I found out there's a lot of education that needs to be done in the communities. I was very surprised by that.
So why don't you tell our viewers a little bit about how the survey was actually conducted and over what time period you did this? Because when I read about the survey, I thought that was really very, very a good approach to take by just doing it ourselves. Sometimes we look at reports and we just give back to the public what the various reports are saying. but you actually did this. So tell us a little bit about the
Yes.
process.
Okay, myself, well, first of all, NBLCA created the survey. And it was a 10-question survey, very simple questions concerning HIV. What do you know what HIV is? Do you know what PrEP is? Do you know what PEP is? Do you know where you can be tested? Myself and a community partner, well, a community partner from the community, went around to different areas. We went to a Freeport area. We went to Amityville, which is in Suffolk County. We went to Hempstead. We went to Ruffles Center and Roosevelt. It was we surveyed 50 people, and we actually spoke to them. And we asked them questions from the survey. And what we discovered is that of the 50 people that were surveyed, there were maybe, I would say, 35% of them could not read. How do we know they couldn't read? Because when we asked them how did they identify sexually, heterosexual was the top one of the answers. And for the gentlemen that we asked questions, they were like, oh, well, I'm straight. And I said, well, the first one is heterosexual. That would mean straight. They were not able to identify, the word. They thought it was homosexual. So that told me that they could not read. There's definitely illiteracy involved. Also, just the lack of knowledge in general of what's going on in HIV. 90% of them did not know that there is a prevention treatment, PEP and PrEP. They had no idea what it was. As a matter of fact, I asked one gentleman, and he told me that PrEP was when you prepare for a test. So that indicated not only were there some issues as far as literacy, there's no education.
And what you experienced there, of course, is something that we're seeing even around the country. And I think sometimes it is assumed with as much information that is out there on the web, at meetings and so forth, that everybody knows, but clearly your experience just within that survey shows that education is still pretty much needed. It's interesting that you said the person talked about PrEP perhaps being preparation for surgery. I'll just tell you another little story that we had a group of journalists that we were talking about, and we talked about PrEP. And at some point, the person asked the question, what was PrEP? And they said they were just so surprised because they thought we were talking about Preparation H. So the lack of knowledge, the lack of awareness expands the whole spectrum of areas where we need to do far and much more education. And there were a couple other things from the survey that I'd like to get back to perhaps after we hear from Johnny in terms of some of the populations. Now that you are concentrating specifically in Suffolk, right?
Correct.
So what are some of the populations you're seeing at greatest risk out in Suffolk? Because we don't hear a lot about Suffolk County.
Right, we don't hear much about Suffolk. However, the population high risk are African Americans, Hispanics, and substance abusers, individuals who are, majority of them, like Barbara said, education is one of the major compounding, one of the major issues. In terms of literacy and so forth, I had, education, information, most of it. And nowadays we are, in terms of PrEP, we are confronting some, when communities, health services go out in the community and provide services, information about it. Some people feel that what I'm saying is the community centers, they only go to certain area where most people are congregated, and when they go to a different area, they want to know it. They want to have the information. Whatever pamphlet is passed on, and some other areas it's like I already have these. I don't need these. where in terms of PrEP, like you said, there are terms for it. They'd say preparation or something, what PrEP, or what I'm also experiencing when I'm in the community doing outreach and talking to the community, outreaching the individual, tell them that the HIV/AIDS is still in existence. That just, you know, I'm on PrEP.
They say that they are on
I'm
PrEP.
on PrEP. Like, I don't need to know that anymore. I'm on PrEP. Okay, but you know that. But still, you know, these are the resources where you can, if it's not you, because you're in PrEP, maybe your friend, your neighbor, whoever might need, you know, use this information. What I'm encountering a lot now is when we go out to clubs and we're mainly LGBT places, clubs and so, and what I'm encountering now, and it worries me now, they're saying that I'm married.
So therefore, they are not
At risk.
high risk.
Correct.
Very interesting.
It is very, and for the last...
Which, by the way, is the same response we often get from heterosexuals when we try to go in and have those conversations. Oh, I'm married.
Yep.
Okay.
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 Exactly. Right, and I have done HIV testing for many years, and I had encountered the language barrier and
was wondering about
literacy.
that.
Yeah. In other places where I had done HIV testing, I had to either translate, I had to do the role of HIV tester, counselor, and translator at the same time. There are some places where the HIV forms are not bilingual. That's one part, or not only Spanish, but any other languages. And then comes the question about what heterosexual means, and have encountered the same as Barbara, you know, like they don't know what it means, the meaning of heterosexual, either in their own language. Their humble response is like, I only have sex with women. Oh, okay, so that means that you're heterosexual, that makes you, okay. Right, and during those testing times when I had asked, you know, do you have a reason to be tested? So, well, not really, but because I'm married, you know, but just in case, you know. It's very interesting, but now the gay community is facing that. That, you know, hand them a pamphlet or an information where I'll give them information about PrEP and so on. The response now is like, I'm married.
Yeah, yeah. Well, I think it's interesting to hear both of you talk about what you're encountering out there from the survey, as well as your day-to-day work on the ground, because I think sometimes, again, when these decisions are being made about funding, about what we need to do to actually meet the goals of the end of the epidemic here in the state of New York, of course, which we know the blueprint that has been put forward by our governor by 2020, significantly reducing the number of new infections down to at least 750. It takes a lot more than just putting something on the paper, and that's why I think, you know, being on the ground as you are is so incredibly important. And I think, Barbara, I heard you speak about some of the cultural barriers in terms of historical ways that some of the people you encounter, African Americans and perhaps even Latinos, look at this issue. What are some of those cultural barriers that you can talk about?
Okay, one of the cultural barriers, it depends on the your audience. Like in particular, if you're talking to faith-based leaders, they, and this is not everybody, but for the majority's sake, usually in their minds, the only people that are that become HIV positive are people that are gay, or if you're a woman, you're promiscuous, which is something that we're trying to demythify because it's something that's really wrong and it's off. If you talk to the average person in the community, and it's funny because I had this discussion with some people on Friday, community members, because I'm always curious as to why people are so fearful and to have HIV testing. And the answer that I received was that it's fear. Everybody is afraid that someone will find out that they are HIV positive, or that even the mere fact that you would go and receive a HIV test can insinuate that you're getting this test because something's going on. So, just trying to, encourage people to be tested for HIV is a challenge because of the beliefs. One of the things, they actually are not educated. It's just a lack of education. And when you do try to educate, it's like, I know, and they really don't know. So the thing is, what I'm finding is, with consistency, because I want them to understand that NBLCA is there for the long haul. We're not coming in and just going to give you an education, a one-time deal, and then we're going to leave. We're going to be consistent. And being consistent in that community means being interested in what they're interested in. What I mean by that is, a few weeks ago, there's an event that happens in the community, and it's very important to the community. It's called Freeport Day. We were the only agency that participated in this particular event. This is important because the community, the people that we're trying to reach, were at this particular event. By them seeing us there and by them talking to us and us explaining to them what we're there for, we're there to empower, we're encouraging HIV testing because it needs to be encouraged. They were very happy. I have people asking questions now, and this is what we want. We want them to ask questions so that we can educate them more, because the more comfortable they feel with NBLCA, the more they will be encouraged to test.
And you're also engaged in doing testing, right?
Exactly. Absolutely.
Yeah.
So now you talked about the fear, and of course we see that's certainly related to stigma.
Absolutely.
And stigma continues to be one of the main reasons why we hear people do not want to get tested, fear of being ostracized, fear of being seen as something different. With all, again, of the information that is out there, everything, the funding, the programs, why do you think, again, that we're continuing to see this level of fear and resistance? I hear resistance. And what do you think it's going to take to really begin to turn these numbers around, or to engage people within the areas in which you work? Let's start with Suffolk. What are some of the things you think it would take to lower the rates among African Americans and Latinos out in the area that you do, that you're working, in which you're working?
Again, I would encourage all the organizations to continue educating the community, going out there to the community, and I will keep them aware that it's a disease that's still going. That has not gone. It's not a 90s illness, or like, because I'm 19 years old, that's not happened to me, or because I'm married. But continue educating the community, continue advising individuals, and not only just like, okay, HIV is there, but link them to care, connect them, refer them to any treatment. There are organizations out in Suffolk that are nonprofit, and there are services for free. One of the things is the insurance. They lack insurance. There's also, we face undocumented community, and it is what it is. If they have it, it's because they have it, and because they did something wrong, but therefore they don't deserve the treatment, where they're not aware of that there is free treatment for them.
Barbara, how do you see the resources out in that area, which I think continues to be a big issue, right?
I was very surprised that I think the resources, it needs to be more. And what I mean by that is there are, as far as I know, there are only 2 major hospitals that have HIV infectious disease treatment. And one of the hospitals, which is located in Levittown, which is the closest, and as a matter of fact, as far as transportation is concerned, there are 3 buses that go there, so it's more accessible to people, but people don't want to use that particular hospital because, unfortunately, you can be seen there. So the lack of, to me, accessibility to other facilities is a problem too. I think if we had, I don't know, we have, what is that, Northwell? Northwell is a good hospital, but the accessibility to buses, transportation, public transportation is really not the greatest. And they have an excellent program, but just the accessibility, getting there, is a problem.
You have really laid out a number of issues here today. First of all, chief among them, I'm hearing educate, educate,
Absolutely.
educate. And that we're seeing among barriers that we already know about, like stigma and fear, et cetera. Now, I'm married as another sort of, I guess, factor that we have to address, because somehow or another people are feeling because they're married, they don't have to be tested, they don't have to be concerned about HIV in general, even though we know that that is not always the case. Mm-hmm. And you've talked about the fact that transportation, lack of accessible services to hospitals, people not wanting to be seen in the community as going in to get tests or to get services for treatment and care. So with all of this, let me just ask both of you, what inspired you to get into this work? A little bit about how long you've been working in the field, and what really inspired you to get into this line of work, recognizing that a lot of what you're saying, unfortunately, has been a continuing problems over the past 30 years. So, Johnny, what inspired you to get into this line of work, and what keeps you in doing this work?
Well, I've been involved within the community. I used to live in Queens, and I used to volunteer for one of the organizations. I don't know if I can say it. Anyway, so I was one of the first programs for Latino population to keep a group of Latinos to help all the Latinos to maintain negative. That was mainly the program. Mm-hmm. And that's back in the 90s. And volunteering there, it's like, and many other aspects of the LGBT community I've been involved. And I've been working in many other organizations, and until I got, once I was asked, would you like to test for HIV? Would you like to be an HIV tester? And I said, sure. You know, I went to get trained and so on, and it was more like, not just to add another aspect in my resume, but it was like more one-on-one with the community.
Allowed you to advance in a field that you had some interest
Correct.
in. And enhance your own skills.
Exactly.
Okay.
So, and my passion for it grew more and more. And I'm a people's person. I go out in the community and talk to the community. This is happening at the moment. Whereas now, being a tester, HIV, hepatitis C, and referring to individuals to other illness and infections. So. That and, you know, just to be out in the community. I love that.
Well, thank you for being a people person. So Barbara, with the next few minutes that we have, just tell us a little about what inspired you and what keeps you in the field.
Okay. Well, I've been doing this work for almost 20 years.
Wow.
And to be perfectly honest, what inspired me is funny, because we have a way of coming back to what I say, the scene of the crime. I'm from Nassau County, but I had the opportunity, I lived in Kentucky for 11 years. But before then, what really got me into this particular field, I was actually in the beginning of the infection when they didn't even have a name for this. And the thing about it is that I can't even tell you how many friends. We were going to funerals back to back to back to back. It affected me emotionally. I felt that I had to do something. So this is not only is this employment for me, but this is personal for me. I don't, I look, these are my people that are being affected. And not for nothing, there's something that I feel that I can do, that I can bring to the table. And what I do bring to the table is the understanding of the culture that I live in. Is not as simple as it seems, but I understand it, and that's what makes me effective in it. And just the love of people just in general.
Well, I think that's great, and I think NBLCA is very, very pleased to have both of you to bring your passion, and as both of you were talking, I think we can all relate on some level how we got in it. I actually came into the field after I had spent some time, over 18 or 20 years, in elected and appointed office. And it had to do similar because of the numbers, the impact in this case among African Americans, and looking at heterosexual black women and the lack of attention. So we all have a little bit in common. And I'm just so grateful that both of you are doing what you're doing out in Suffolk and Nassau County, and the AIDS Institute Fund and made it possible for us to expand in that area. And I just say, let's keep doing it and let's keep reporting it so we can help turn around and make a difference. And I thank you so much for joining me today, and there will be other opportunities to have you come back.
Thank you.
Thank you.
And let me say, to learn more about the work of the National Black Leadership Commission on AIDS affiliates in Nassau and Suffolk counties, check our website, www.nblca.org. Look for us on Facebook, Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact your health and well-being. Please let your family, friends, and neighbors know about this programming. I am C. Virginia Fields, and I thank you for joining us and hope you'll tune in next time for NBLCA's Health Action TV here on Manhattan Neighborhood Network.